Hello, my name is Dr. Kevin Smith. I'm the author of a new book called The Migraine Imposter, which talks about my innovative solution to migraine headaches. I'm going to be posting some of my patients' video testimonials from time to time, some of who have suffered up to 40 years with what they thought were migraines until they met me and got their cure. All I ask is that you follow their amazing stories and help spread the word. So here we are with a video here of Miss Gold's CAT scan, and I'm going to demonstrate to you a very severe septal spur that causes her headaches that she's had for some 20 years. Here we have, just to orient you, the brain is here, the right eye is there, the left eye is here. Here's the septum, and already you can see it's midline at the bottom and it bends over to the right side. As we go back, you see there's a bone spur here to the right where it's bending very severely, and then it tries to straighten up, but then you see it all of a sudden go back to the left here, and it makes contact with this inferior turbinate, and even more so, a bone spur right here that you can see compressing this left middle turbinate. When you have the contact between the turbinates and a bone spur like this, this is what gives you severe chronic headaches that can mimic a migraine headache. So what we're going to do next is show you, we're going to go to surgery here and take this out, and after we take out this bone spur, we anticipate that she should have a much improved situation where the headaches will be relieved. So we'll show you that surgical procedure in just a few minutes. So here we are in surgery, and we're looking on the left side of the nose. On the left side is the septal spur. You can see the ridge starting and coursing its way back. On the right side is the inferior turbinate. You can see there's a depression there, and as we go back further, you can see that this ridge ends in a point right here that's touching that middle turbinate like we saw in the CAT scan. So again, this is inside the patient's nose. It's a bone spur that's touching this middle turbinate and likely causing these 20 years of headache pain that she had that has been mistaken as a migraine. So here we are 10 minutes later. I've done the septoplasty. You can see the ridge is gone. Here's the dimple on the turbinate. The bone spur that was here is all gone, and now we have no contact between the septum and the sensitive turbinates here on the right side. We'll show you what that bone spur looks like in just a second. So here's the septal spur. Here's the cartilage that makes up the septum. There's bone back here. It was oriented in the nose this way, and you can see how it bends off the midline to the right there. If we look at it from below, here's the cartilage and the bone making this sharp arrowhead like a bone spur, and this is what was making contact with her turbinate. Let's hold it this way. You can see how thin the bone is here and how it makes that little elevation there. That's part of the bone spur. Pretty big. This is a ridge that started in the front and coursed all the way back. We also had another piece here that was also bent. This is bent to the other side. You can see where the cartilage is here, and there's that step off right there. So that little sharp point right there can also cause problems. So it's fairly easy. We've taken it out. We're going to let her heal up for about a week or two and come back and